So this past term, I completed my placement at Access Alliance Multicultural Health and Community Services in the Research Department. This is a community health center which is based in Toronto. I completed my topic, as Michael said, on an environmental scan of social determinants of health tools in primary health care, and I'll explain what that means throughout the presentation. For the purpose of this presentation, I described primary health care as healthcare services delivered on a primary care level. For this presentation, I'm going to go through the background, methodology, results of the environmental scan, and conclusion. As well, we'll have some time for questions at the very end. So addressing the social determinants of health, as we all know, has been a core activity of public health in Canada. And the Public Health Agency of Canada has been a leader internationally on taking action on social determinants of health. And it's been part of mandates of local health units, health authorities as well, to incorporate a social determinants of health focus in the work that they do. Mainstream medical organizations have also started to recognize the need and the evidence on social determinants of health and have incorporated it into their mandates of action. However, we're still a little behind in putting this evidence into routine action for healthcare providers. So the scan was part of a larger grant application which is taken on by Access Alliance, which is to bridge the gap between social determinants of health evidence and put this into routine practice and action. So why is this work important to primary care and public health? We're all very familiar with this diagram from our public health program, which shows that health is a complex issue, and there's many factors outside the healthcare system which affect our health, and they all interact and interplay with each other. I really like this quote from Dr. Mealy, who's a physician in Saskatchewan, and he says, "The weight of the evidence for social determinants of health and the need for creative system-wide policy changes to address them is simply too great to ignore. This indicates that it's a moral imperative and a social justice issue. We cannot ignore the evidence on how social determinants of health affect our health and not do anything about it. We need to take action on it." Investments, as we know from the presenter this morning, have risen in the past decade in Canada greatly. However, we don't necessarily see the improved health of many Canadians. In fact, health inequities have increased between various groups of Canadian society greatly in the past decade. These health inequities are not only costly to the individual and their family, but also society as a whole. Primary health care is often the first point of healthcare contact for most Canadians, and therefore it provides the ideal opportunity to address social determinants of health. Healthcare providers have the opportunity to address social determinants of health for their clients and the people that they serve when they move beyond addressing each individual's medical complaint and their lifestyle behaviors and move towards changing the economic and social conditions which affect people's health. So the purpose of this environmental scan was really to obtain what's called clinical practice tools, which is a tool, a method, or a best practice that can be implemented into primary care that helps a healthcare provider screen, assess, intervene, or refer on one or more social determinants of health. So to do this environmental scan, I started with a literature scan, and that was to search through academic and gray literature to find what exists out there on clinical practice tools. The academic search was conducted through EBSCOhost, which searched a variety of relevant journals, health journals, as well as the gray literature was conducted using Google Scholar, and hand searching individual organizational websites. For the key informant aspect of the environmental scan, I was able to connect with 8 key informants across Canada who are known to be taking action and working on developing clinical practice tools on social determinants of health. From the environmental scan, I found that there was a total of 12 tools, 6 from the academic and gray literature and 6 that were provided from key informants. The tools mostly focused on decreasing barriers to accessing health services. And they focused on referring and connecting patients to local services in their community and supports that could help their clients' health. This is a very evolving topic in Canada. Right now, it's just on the verge of, it's a big movement, and these tools are still being developed. So part of the environmental scan was seeing how these tools are being implemented into care. However, I wasn't really able to do that because the results still aren't there. So that will be an area of next step to take. Well, I didn't find that many tools. I did found that a lot of primary care organizations do offer programs and supports that have a social determinants of health focus, but it's not put into routine practice. There's no routine way to say, you know, a healthcare provider's routinely, and they're all doing the same thing. This is an example of some of the tools that I found. I was going to speak about the clinical poverty tool, but Katie nicely spoke about that. I'll say about the tools that they're all very different. However, many of them are very healthcare provider focused. So the healthcare provider uses the tool. However, area that this could go in is that it's very client driven, that the client assesses themselves by a standard tool. Some of them were administered on iPads, so that's a new way to go, where a client identifies what their gaps and resources are and their health needs as well. So as I said, a limitation of this project is that practice tools are still starting to be developed. I use the internet as the main search to find these clinical practice tools. I'm sure there's a ton of tools out there, but they're just not available on the web, and they're unique to each individual organization. Future tools should try to develop standard outcome measures and evaluation criteria so that we ensure that they're not increasing health inequities in the client population that they serve. What I found from the literature is that we need increased collaboration between public health and primary care. Public health has lots of experience on addressing social determinants of health, and primary care can draw on those strengths and foster collaboration. Another thing that the literature mentioned is that we need increased stewardship and leadership. We need people in Canada who want to take action on social determinants of health, and we need to incorporate this into our medical education for nurses, doctors, other healthcare providers, so that they feel confident when they're practicing in care that they can take action on social determinants of health, and that they're aware of the resources and supports for their clients in the community. So I'll leave with this quote. It says, "If health leaders are to move towards health equity with any effectiveness, all partners in society need to be mobilized." This demonstrates that taking action on social determinants of health, it doesn't occur in one silo. It's not public health, it's not primary care, it's not responsibility of one sector, it's the responsibility of everyone. I wanted to acknowledge my practicum supervisor, as well as the key informants that I was able to connect with through this project, as well as obviously all you guys and University of Victoria faculty. And any questions?
Okay, any questions for Johanna? Don't be shy. Don't let the picture fool you.
It was supposed to be a joke, so I'm open to questions. No. And those were my references. Thank you.